my name is Michelle Thaw, and I am running for a House seat in District 71, which includes parts of Portsmouth, Tiverton, and Little Compton. So I will be in a primary against Dennis Canario, who's our current representative.
Can you keep your voice up a little bit?
Oh, of course. Yes, sorry. The reason my road to deciding to run was sort of a long one. I have spent the last several years trying to find someone to run against our current representative. The more that I talked to people in the district, the more I found that people were not happy with the representation that we had, and I kept waiting for someone else, trying to find someone else. And the more that I looked, the harder it was to find someone. And the more I asked people, the more people told me that it should be me. So I kept asking. Let me just add a little bit of my history. I'm on the board of the Democratic Women's Caucus as well, so I have a pretty broad network politically of women that are involved in politics, and I'm also on the Democratic Town Committee. So as a part of that, it really helped me to reach out to people in our community. What we did was we started a Seconic outreach where we were trying to draw in women from those three communities to get more active in politics, whether it was at the town council or the school committee level, on the Democratic town committees, or for a House or a Senate seat. So working in cooperation with all three Democratic town committees, I was able to do a whole lot of outreach. And so again, that's how I was reaching out, trying to find people to run in those communities. I was continually being asked to run. I think what really started leading me towards running was last year during the discussion for rules reform in the House. And there was discussion to change the rules in both the House and the Senate. Both the Portsmouth Democratic Town Committee and the Little Compton Democratic Town Committee passed resolutions asking for our representative to vote for change. They wanted to see a change in the rules. Unfortunately, our representative declined and told us that instead he was 100% behind the speaker and those were his rules. So that was concerning to us, and that certainly started the wheels turning in my head. And then I was approached by the political cooperative, and they were encouraging me to run. And then over the summer, my representative actually quit our Democratic Town Committee because what he called our radical ideology, which was indeed the Democratic platform. And so as the folks on those three town committees started looking they were really seeking someone to run, I decided that it was going to be me. So that's really why I'm running. A little bit about my background. I am a pharmacist. I've been a pharmacist for close to 30 years now. So I have a really strong background in healthcare. I've worked in retail pharmacies. I've worked in home infusion pharmacies. I've worked in hospitals. I've worked in the managed care industry, helping to build some of those formularies and some of those blockades to getting access to medication. So I've seen that side of it as well, and I now do nursing home care. I'm a consultant within nursing homes, helping homes stay compliant with Medicare. So I've seen the impact of access to getting your medication on so many different levels. And so I'm excited to bring that experience as we start to talk about what we're going to do about healthcare in this state and in this country. I really feel like it's important that we have people with a medical background to be a part of that discussion. So healthcare is a big part of one of the reasons that I'm running. So legislative reform, as Josh mentioned, that impetus for me to run being the House rules and trying to change the structure so that there was more transparency in our government and more of a voice of our voters being brought to the State House. When we think about the way the rules work, we're expecting that when we vote for someone that they're going to have a say at the State House. And right now, the way the structure is set up, their voices are really they don't have the power that they should have and that we expect them to have when we vote for them. So legislative reform, healthcare is on my agenda, and climate is also huge on my agenda. All of the communities that I have low-lying areas that are at significant risk for sea level rise. Many of those communities are expected to be underwater by 2050. So I think we need to be planning ahead. We need to be working on infrastructure to help protect those families and planning for not only reducing carbon emissions, but what we can do for the families that are in the communities already. And there's also it's a big farming community for us. So as I go out and I've been talking with the farmers about the impact that the climate's been having on them. And going from heavy rainfalls to drought is impacting their livelihoods. And so, so for our communities, we really, climate is a really big issue for us. So those are the three things that I'm really focusing on for my community.